Amidst the information overload about the coronavirus, it's important to get the right information from the right authorities. I'm joined by one of the top doctors of the world, Dr. Randeep Guleria, the AIIMS Director. And sir, how serious is the situation? What after the Prime Minister's address yesterday and the obvious, chinta in his voice? I mean, what would you feel that how serious is the situation becoming?
So it's a cause of concern, and it means that we have to start being very proactive in trying to prevent the spread of infection in our own country. Data from abroad, especially from Europe and from US, is pretty frightening and pretty worrying, and we have to take all steps that we don't move in that direction. And I think that is what was the message that the Prime Minister was trying to give, that we have to start being proactive as individuals in terms of social distancing, home quarantine, avoiding crowded areas, and making sure that we don't become part of a chain which spreads the infection to the community and thereby causes a large outbreak, as has happened in other countries.
How serious is the threat of community infections right now?
So the threat for community transmission is serious because of the number of cases that we are seeing. And I think it becomes even more serious if people don't understand the responsibility of isolation, of staying at home, of avoiding crowded areas, and not having parties or having big programs where there is a crowd. Those are activities which act as a catalyst for infection to spread. We've seen this in South Korea, where because of a large crowd in a church, there was a huge number of cases. So we have to be very proactive and responsible to prevent this from happening, and we need to do this by simple measures like social distancing, not going to places where there is a crowd, regular hand washing. If everyone in India takes this pledge of doing this, I'm sure we can prevent a big outbreak from happening in our country.
With a population as big as ours, do you think that's possible?
So with a population that as big as ours, it's always a big challenge. But the important thing to remember is that the outbreak is more likely to happen in crowded places, that is big cities and even smaller cities. It's less likely to happen in rural India, where there is already that much of crowd does not happen, and cases coming from outside are less likely. Therefore, this has to be done by people who are in bigger cities or towns, and if they are able to do it, I think we can break the chain of spread.
Community transfer is a big threat, you feel, of course. But as a country, how prepared are we if such a transmission does start happening? Because there are instances like the Bollywood singer Kanik, who was sort of found having, not misreporting her arrival from a foreign country, and then having a party with about 500 people present.
So that's why I said we need to be responsible citizens, and if we have come from abroad, if we have come from a country where an outbreak of COVID is happening, we need to self-quarantine ourselves. If we have symptoms, report to the health authorities, get ourselves tested rather than going into a crowd and being the cause of spreading the disease. We've had time because this has been happening since January, and the government has been very proactive, and a lot of steps have been taken in terms of improving our healthcare facilities, training doctors, getting equipment, and getting isolation wards ready, getting ICUs equipped, not only in major hospitals but at all state level and district hospitals, so that if an outbreak occurs in any part of the country, we can upscale our resources to manage these cases.
How prepared are Indian hospitals as on date?
So Indian hospitals or the healthcare system has a challenge because we already have a large number of cases. So this is an extra load. So we have to reorganize ourselves in terms of decreasing non-emergency procedures and surgeries, creating extra beds, training individuals in infection control, because this is also an issue that while managing these patients, the healthcare workers should not get the infection. It's an infectious disease. So that way we have to really do a lot of homework in terms of preparing ourselves. That is being done and has been done to a large extent. Most hospitals are doing this in terms of infection control policies, in terms of seeing how they can upscale their isolation wards, their ICUs, how they can pool the ventilators so that they are available to the patients when they need them. These type of contingency plans have already been put in place by most hospitals.
Uh, As far as testing is concerned, India has faced a lot of criticism because of low levels of testing. Do you feel we need to change our testing criteria now and increase the level of testing in the country?
So as the number of cases increases and we want to know or be sure that we don't miss community spread, we will have to start evolving into different strategies, which will look at what are the ways that we can do more testing. But at the same time, as we start doing more testing, we also need to work on building our capacity so that if we say that we're going to do more testing, we also have the capacity to do that testing. And I think we're working on both sides to see when we need to open up the testing criteria and at the same time get more and more labs ready so that they can do more testing, and at the same time also look at private partners coming in so that that really upscales the number of labs that can do the testing.
How soon do you expect private testing to start?
So a lot of private labs or I would say manufacturers have given their testing kits to NIV Pune. They are being validated because the most important thing is that if you are doing a testing, it should have a high sensitivity and specificity. You don't want to have a test which gives you a low sensitivity or gives you false positives or false negatives, because that will create further chaos when it comes to the testing. So once that is done, that you show that this test or this kit gives you an accurate report, then I think it should be cleared by the drug controller, and we should have that. I am hopeful that this will happen very soon.
Would you want to put a timeline on it, some tentative timeline?
I would say within a few days.
Within a few days, you expect private labs to start.
The kits are already been there with the National Institute of Virology.
Right. What about the fears of a lockdown after the Prime Minister's address yesterday and the his call for a curfew, private curfew, so to speak, a Janata curfew, so to speak. What do you feel? Is that the drill for the future?
So I think this is a way to make people aware and prepare themselves and to understand their responsibility. So the Janata curfew is, I think, a big step in trying to really do what we've been saying in terms of social distancing, not going out and staying indoors as much as possible. This is also a way of trying to get people to sort of get used to this. If a lockdown is required, we should do it at the right moment. If we do it prematurely, it will not be that beneficial and it may cause a lot of economic problems to especially daily wages and others. So we have to do it at a right time, and I think that is something that the policymakers and everyone needs to sort of think and get together and see when it should be done. Uh, if the number of cases increases, if there's a regional outbreak, should we do a lockdown in one area instead of the whole country? That all needs to be thought through before we really go in for a major step like a lockdown.
When should I get tested? If and how and when and how should I get tested?
So as of now, if you are an individual who has not traveled abroad in the last 2 weeks, have not come in contact or close contact with a laboratory confirmed patient of coronavirus, and if you have any symptoms, you need not get tested. These are the only two criteria, that if you have traveled in the last 14 days to a country where coronavirus outbreak is happening, that is abroad, and you have symptoms, you should be tested, or you have come in close contact with an individual who is a lab confirmed case. Otherwise, if you have any symptom like fever, cough and cold, it is basically a common flu or the common viral fever that is happening during this time of the year. So you need not worry at all.
So no worries if my colleagues or somebody in my office has a cough and I would not need to run a mile from that person right now.
There is a big panic. I mean, there are patients of mine who have chronic cough for years because of a chronic respiratory disease, and they're scared to cough in public places because if they cough, everyone stares at them and moves away from them. So I think you must understand that everyone who's coughing doesn't have coronavirus, and currently there is no community spread. So that panic should not be there. It has led to a lot of misinformation and things which are not right, like students not being allowed to enter the tenants not allowing the students to come in because they've gone out for a meeting and they feel that they may have coronavirus. Those type of things are just panic reactions.
Right. So don't create panic, but be cautious. That's the message from Dr. Randeep Guleria. We'll keep coming back to you with more. Keep watching HindustanTimes.com.